today, most of these tests are tissue-based, so they're under the guidance and supervision of the Department of Pathology. And it's really led to a radical change in pathology departments dealing with cancers. Whereas everything before was focused on a pathologist making an expert judgment by looking at a piece of tissue under a microscope, pathology departments now have to get these genetic tests done, get them done very quickly with near 100% accuracy, and factor that into the decision-making process as to what kind of cancer you're going to say this person has and the characteristics of it. And it's asked them to kind of turn themselves on their head. I mean, again, it was all about looking at tissues under a microscope and being very precise there. Now, in addition to that, which we still use and need, they have to develop all this technology to get this done. And other specialties have been affected too. Now, it used to be that lung cancer, the area I work in, it would be diagnosed on maybe just a few cells. A lung specialist would brush a tumor and a few cells would be sent to the pathologist. They'd make a diagnosis, or they put a tiny needle into the tumor to make a diagnosis. Now they need more tissue because it needs to be sufficient for the genetic analyses that are so critical in making decisions now. So doctors that do biopsies, doctors that analyze biopsies are being asked to do a lot more. But I think they gladly do it though, because they know that leads to better decisions for patients. I deal with the lung cancer area, and there's so much concern and fear when that diagnosis is made. And people discover my lung cancer spread to my bone, it spread to my vein. And when we find one of these genetic changes, people come so fearful about what's going to happen to me. And I say, well, we found this genetic change. I want you to take these tablets and come back and see me in 1 or 2 months. And the patient is kind of shaking their head. They say, wait a minute, I have lung cancer, it spread to my brain, it spread to my bone. I've heard a lot of very scary things, and suddenly you're handing me this prescription and telling me to come back in 2 months. But that's how things can happen now. And that's how potent these changes are for the cancer cell, and how potent the drugs are we have to help people with those changes.